I love people who have what I call smiling eyes. And Jeff has smiling eyes. And you can always count on and rely on people with smiling eyes.
We had both established our professions, and I was teaching and he was working at Baylor University. And we had had 2 children by then. And one night we were praying and we said, Lord, we don't ever want to be complacent. We love Texas, but we always want to be in your will. That was our prayer. Boy, within a week or so, other options came open, and we ended up here in Augusta.
My last staff meeting at Baylor I was a part of, there were 35 chaplains in the room, and that was a normal staff meeting for us. And then when I arrived here, I looked around, I realized it was just me. 24/7, level 1 trauma center, NICU, PICU, it's just me.
He felt he needed to be all to everyone, and so he chose to be on call 24/7 because he didn't want anyone to be without services.
My goal really was to come here and create a clinical pastoral program. And I thought, well, the best way to do that is to do clinical pastoral work. So I asked them all, if you need a chaplain, call me, I'll come. That was my covenant with them. Well, they did, and I did. And week after week and month after month, they called, and I got so weary and so tired because I was running out of energy. I hadn't thought my way through that. And I got a call from my friends at Baylor, and they said, we haven't filled that position, and we're waiting to see if you're going to come back. So I actually wrote out a resignation letter. I put it in my pocket, and I was going to go see one of the best people you'll ever know. Some of you know her. If you haven't, I'm sorry you didn't get to know her. But Miss Pat Saddam, because she was head of our hospital. And she talked about my department. She said, there'll be a time when you're going to have help, and you're going to be a part of building something that's going to be really good around here. But right now it's going to be hard for all of us, but we just have to get through it. So I kept a letter in my pocket, and I took it and I tossed it in the drawer in my office, figuring I would use it next week. And that was 22 years ago.
You had a vision of building a department. When I look at our team now, I'm aware that we've come a very long way.
More than I could have ever dreamed.
So several years ago, we started doing a program of ethics where we try to make community leaders be part of our ethics committee.
We probably do not have as many ethics consults as many institutions of our size have. Jeff and his other chaplains have had the ability in their making rounds to basically preempt the necessity for an ethics consult.
So we started out with what's called CSR and Scrubs. We've kind of taken it and it's kind of gotten a life of its own to some degree. And one of the things that has happened is that we've now gotten to the point of where we started training all third-year medical students in ethics, as well as it's kind of taken off to other of our health science schools as well. We do it for nursing, we've done it for allied health, and one of the recent things is we've done it for high school students.
Jeff likes to win. He hates to lose. That could be with anything. It's just not golf. He's a very competitive person.
And he's curious. He's always wanting to know more. He asked me about my job, and he wants to know more about education.
I think the one thing that I learned most from Jeff is that we have to meet people where they are.
He knows about love, he knows about understanding, he knows about how important it is to give rather than to receive.
One of his key real skill sets is being able to create that relationship with the patient and the family, to try to understand what they want, what they need.
He was there when we heard the words from the surgeon, make the most of tonight with Daniel, because he probably won't be with us tomorrow. And so Jeff really was there to provide that emotional support for us.
I watched his compassion for people and his attention to detail, and the fact that he genuinely cared about the people he was talking with.
Matthew 25 is the great gospel element where they're trying to pigeonhole Jesus a little bit, and they're trying to say to him, well, tell us the rules. And he says, well, I was hungry and you gave me food. I was thirsty, you gave me to drink. I was naked, you gave me clothing. I was sick, you came and visited me. Well, when did we do that to you? Well, what you do unto the least of these, you do unto me. And I'm mindful every day when I walk in the hospital, that's what I get the opportunity to do.
His ability to have compassion and feeling and sensitivity for the situation makes him, in my mind, one of the most human individuals I have ever had the opportunity to work with.
And sure enough, it's a Thursday night, and I'm on call, and I get a call to go to labor and delivery. All I know is that a young family has had a birth and it's not going well. So I just said to them, do you have a name? Have you named her? And Mom said, yes, it's Cassie. Would you like to hold her? For the next little while, they just told stories. And I was part of their story. And the nurse came in, and this time she brought the doctor, and I knew that that probably meant that we were at the end. And she leaned over, and the doctor leaned over, and he kind of looked, and he said, Cassie's died. And people did what you would expect. They began to cry, and they began to hold each other, and I was just in the middle of it. And so I was holding them too, and Mom calls my name. She says, Jeff, I need to ask you something. I don't know if you can or not, but would you be willing to do Cassie's funeral? You're the only minister that Cassie knew, and you're the only minister who knew Cassie. We did a graveside, and all their family was there. And I just said, I'm reminded this day that life is never measured chronologically, but by impact. And I told how she'd lived for 1 hour and 12 minutes, according to the record. But she'd lived forever in me because she changed me. So everywhere I've gone, and when I teach classes, and when I talk about patient family-centered care, I tell her story. And that's kind of what I get to do, help people see the meaningfulness around them. Kind of a cool job.
Jeff, I'm so proud of you, and you're so worthy of this honor, and I'm glad that other people recognize all the things that I love about you.
Thanks so very, very much. We all love you.
Truly, you are a colleague and a friend.
And remember that I love you, and you are a mad man. Just like me, you make a difference. Bless you, buddy.
So I still have the letter, but I don't ever want to use it. I use it now as an archive periodically to say, when somebody, especially if somebody says, I'm tired, I think I'm leaving, I say, let me tell you a story. Stick with me. Let's do this together.